And 5 RTFWA with the XA. Guess we're just waiting.
WAXA M5 RTF. Yeah, I checked in early, but I don't think I'm getting through to the main net. So we'll see what's happening.
Yeah, I heard a couple other people chunk in, but that was about it. You're the only one that I heard a voice. So we'll see. Okay.
I'm listening on G-Star, which is where I get my audio for recording the net, but it's not making it through to the rest of the club net.
I'm transmitting through DMR, so it's a hotspot. I guess we'll see what happens. WA with the XA is listening for the Marco Net. No one does pick it up. Okay. Um, This is the Marco Net. Looking for check-ins. Is there anyone around? WA1EXA here. This is WA1EXA. Looking for check-ins for the Marco Digital Voice Net. WA1EXA. Looking for any check-ins for the Marco Digital Voice.
WA1EXA and 5RTF. The net's going on D-Star, but the DMR can't access it for some reason.
Okay. I'll listen along, and if you could pass along that I'm here, but I can't hear anybody, obviously. WA1EXA.
Streaming the audio, so if you want to listen to the net on the audio stream, check your email for the access link.
I'll go to my computer. Thanks. I'll be listening.
In 5RTF clear.
A4SL and 4TSC. Not sure whether you can copy me or not, but I'm here. Over. A4TFCWA with EXA. It's some reason it's not working through DMR. They are on streaming to listen, but we can't connect.
Live stream. I think NetLogger, you can post questions that way. Over.
Yeah, I'm listening on the Marco audio, but my NetLogger is not working properly.
Roger, Roger. Now, I will make sure Jay gets you checked. Katie for us.
This is WA with the XA. Anyone listening for the Marco Net, it's not coming from DMR today, but is available on the live stream or through LogNet, NetLogger.
This is Katie for us. The link is marcoaudio.net, and it is live streaming there. Are you having trouble getting the live stream? Over. This is Katie Four Eyes. Um, I'm calling those who wish to check into the Marco Net this morning to let you guys know that we are having an audio connect problem, so it's not possible to hear um, the DMR check-ins on the array. If you will let me know you wish to check in, I'll try to relay that information to Jay and get you logged in. You can go to the live stream on www.marcoaudio.net, and Howard is now presenting. Over.
20XA is listening to the feed.
WA1EXA KD4 said, yes, he has you logged in. You're on the list.
Thank you.
DU3 Whiskey Tango Japan.
PU3 WTJ KD4 Eyes. Hello, Mr. Senju. This is Jack. We have you logged in on NetLogger. Are you able to get to the live stream? Over.
KD4 Eyes, this is DU3 Whiskey Tango Japan returning. No, right now I am outside of my base station. I'm traveling somewhere and I'm just operating mobile. This is the thing. Microphone back to you, KD4 Eyes, DU3 Whiskey Tango Japan, over.
Okay. Well, I'm sorry. I don't think we are going to get any help from the folks on the array in terms of getting things reconnected. I think they're they're struggling with some problems there, and hopefully we'll be able to at least you'll be able to hear the recording. Glad to catch up with you, and I'll pass that along to Jay. Over.
34 Isaac, this is VU3 Whiskey Tango Japan returning. Thank you so much for the info. I will catch you up in the next week. Thank you. 73, bye bye.
7-3 and drive safely. VU3 WTJ, Katie 4I said 7-3 and clear.
Not linked. Not linked.
That are much lower threat level from COVID. They're not dealing with the death and the morbidity in addition to the mortality. They're just not having to deal with that on a daily basis. Probably more stress again from the business side. Anyway, I've said too much. I'm going to turn it back to Howard to continue with the discussions.
Thanks, Jack. This is N9OML. Let's briefly pause if there's any station that would like to check into the net. This is the Marco Medical Net. This is station N9OML. I'm handling net control on a temporary mutineers basis just to cover a topic that I had brought up. But if anybody would like to join the discussion or just check in to let us know you're out there, please call now. This is station N9OML on the Marco Medical Net using the QuadNet array. N9OML, continuing where we left off then. Yeah, Jay's comment on the impact on the business of medicine isn't anything that I think should be taken lightly or dismissed. At the emergency level, again, my world, schedules were greatly changed, and when they do that, nobody makes any plans for child care and the like. It creates huge stress for families. For example, the staff in a dental office, I'm not certain, but I believe in Illinois, where we're a very big thing, the dental offices are compelled not to see patients except for emergencies during the same period that they put out the rules suspending elective surgeries. And again, suspending elective surgeries put people at home or working COVID cases, depending upon their exact skill set. And very few employers can afford to pay people or choose to pay people. So those aren't minor things. And in my mind, that kind of speaks to the ripple that I was talking about. It's one thing if you're seeing the patient's impact, but it's also a huge issue if you're stressed out at home over the family issues. And the people that were probably most affected on the income side are probably one of those that are closest to living paycheck to paycheck. So those are not minor issues in any way for people, and may be the ones that trigger problems for them down the line. Stand by. And I know I'm out continuing. Another thing that I think we see with emergency providers is, at least at the command level, we try and make sure they know the resources that are available to them to get help. And I don't know if that's done for other types of medical people, whether they get any actual training on recognizing signs and symptoms and how to acquire help. And then maybe around after this, we can work on taking some of the stigma away, which is a big issue in our world. But at that point, why don't we go, by the way, anybody else that has a thought, wants to take this another direction, let's do this as a discussion. Again, I'm not pretending to be a professor here. So, KD4IZ, this is N9OML. Your turn, sir.
Well, I'll apologize, Howard. I had to step out for a minute. Can't edit this. I just got back from upstairs. Had to check in with Susie. So, anyway, we're kind of busy today, and I'm going to follow along, but I may be in and out some.
Okay, Jack, that's no problem. Probably call on you again as we go around. If you're there, we can use whatever input you have. N5RTF, do you have anything at this point to answer?
No, I'm enjoying the discussion. I'm trying not to take up too much airtime because the way this is set up, my own audio is not getting streamed or recorded, so it's just dead air for most people, listening on the computer or listening to the recording. So I'll just sit back and enjoy the discussion. N5RTF.
And AA4FL, we're back to you. If you have additional comments, please make them. And then I'm curious, from your perspective, both as a university professor involved in teaching dental students and having run a practice, did you encounter much in the way of training on recognizing problems and resources that you could bring to bear, and how as a peer to help others? And I can see that being a factor in a number of settings, the university setting, your practice setting, and I think you were affiliated with a hospital at one point also, or teaching in the hospital. I know you made reference to hospital care. But were you guys trained in recognition of signs in coworkers, how to nudge people towards possibly seeking professional care or talking to someone, and what was available to you? And then any other comments you want to make, Jay. This is N9OML, AA4FL, to you, sir.
This is N5RTF again. We all had some training in crisis counseling and working with other people in healthcare, but over my career, I've specialized in severe major mental illness, usually inpatient care, ECT, things like that, which goes way beyond the usual office practice. So I've done less of that over 44 years than most people have. And 5RTF.
Okay, thank you on 5RTF. AA4FL, over to you with the same basic question or any other direction. Take us.
Thank you, everyone. This is AA4FL. I will. I don't have a lot to offer directly on that because I really am a part-time faculty member. I've had private practice experience for the most part at the university level since 2004. Most of my time has been spent with engineering students. Well, there's other students on campus that are affiliated with the amateur radio station, but most of my time volunteering has been managing that. I do want to give WJ8B a chance. You may not be aware that he's here checked in. So, Howard, if you don't mind, I'm just going to defer to WJ8B if Andy's copying us to offer his comments. Go ahead, Andy. Okay, perhaps Andy was relying on DMR. We did get a NetLogger message from Hilton. He's connected via D-Star. He just arrived home. So I'm going to go ahead now. You called on him before, Howard. So Hilton, if you're here live with us now through D-Star, Howard has asked for you to offer some input on the subject matter, the stress on the professionals, the individuals in medicine from dealing with all the emergency. Can you tell us a little bit on the Brazilian side, what that experience has been within the medical community and the stresses due to having to treat all the COVID patients with dire medical consequences? Go ahead, Hilton. QSL, good copy, Hilton. Proceed. Okay, thank you, Hilton. So, Howard and N9OML, I think everybody on the list that's got access other than DMR has had their opportunity today. So I'm going to let you turn it back and maybe put out a call for some other little threads about the subject and pick it up from there. So turning it back to N9OML, this is AA4FL Net Control for the Medical Amateur Radio Council, DVNet.
Thank you, Jay. And I know I'm out here. We'll do one last call for check-ins in the middle of this discussion, and then maybe one more round of comments anybody has. Okay, a comment for this last round, and understanding it's the last round, also feel free to go in whatever direction you feel is appropriate if you have other comments to make or something we didn't tease out of you. In the emergency response world, there's admittedly quite a stigma about going for mental health care, and we're working on that and getting better. Additionally, and I assume it would be true in regular people too, normal people, an amazing amount of work is done by these folks in sometimes horrific circumstances like we're describing here, and they plug along. They have their moments, and they may need some quiet time, but we don't see the problems. But problems can manifest, over time, and those are probably going to be the more difficult ones to deal with, and I don't know what that time frame is. I have no real inkling as to that, but I was curious what people's thoughts might be about the recognition skills of when to seek help and help that's available, and the longer term impacts of the exposure some people have had, particularly people that aren't used to this. In our world, kind of in a macabre way, they would say, it's okay to die in a smoking hole in the ground as long as you look cool doing it. And people that work with that kind of attitude don't really show too much emotion in the midst of an emergency. But we know we have divorce problems and drinking problems and suicide problems and sleep problems as time goes on. Here we're dealing with people that haven't had that around them for their whole career. So with that as a comment, if anyone wants to comment further or has other thoughts on long-term mental health for healthcare providers, let's run through the list again. KD4IZ, did you stick with us, and do you have any comments, sir?
Well, sort of a past tense comment. Going back to your question about academics, I taught for a large number of years at the University of Texas, San Antonio, at Memphis, the UT Memphis, and then here in Baltimore at the University of Maryland Dental School. I don't think we did a real great job of preparing students to deal with the psychological stressors. My term at the university ended in 2008 when I went to the dark side and went into biotech. But my impression was that the students got, some basic, maybe a semester's worth of what they called dental ecology, which is sort of the relationship of the profession to the rest of the community. Those courses included legal, psychological, other things. I think they stressed substance abuse and what avenues were out there to help people deal with that. I don't remember them stressing other bits and pieces that would have helped folks a lot deal with both the business stress and the personal stress. I don't know how well folks are prepared for that. So in a way, I'll mirror sort of what Jay was talking about. But I think that's just, if you will, a failing within dental education of the time. What they're doing now, I'm not sure. I've stayed out of the way. I've been absorbed in other things. So that's sort of my take on the track. Back to you, Howard, and I know I'm allocated for, I said.
Thank you, Jack. This is N9OML. One of my concerns is my clinical time in the emergency room. I was still employed by a different agency. We were there to work in the emergency room, to be observed, to look
not linked. Linked at RF757A.
Okay. I'm not receiving Milton. Didn't see his name come up as a DMR either. Continuing chip N5 RTF. Do you have any comments either on the last ramble that I went through or anything else you think would be appropriate to at least close this discussion at this time regarding the long-term effects that we may see down the line?
No, I don't think I got all of that. I think there was some dead air in the middle of the discussion, but this is new territory for just about everybody. We've all been through emergencies. Down here we have hurricanes. Maybe things are disrupted for a few weeks, at most a few months. This has been 2 years. I don't think anybody's ever lived through something that's been this troubling, traumatic. So there's a lot to learn from it, and I don't know how we can prepare people going forward, but somebody's bound to put it all together and do a better job of educating people and getting them ready for what may lie ahead in anybody's future. N5 RTF.
N5 RTF and 9OML. Yep, thank you. That's partly where my concern is we may need, as a workforce across the board, some educational efforts to keep stigma low and make sure people are aware of resources available and make sure we have resources available. Again, working in government, there were laws that mandated what was there and the contracts existed, both within agencies and outside sources to allow some anonymity. I don't know how that works for some of the private sector folks. JA4FL, why don't we do this way? I'm going to call on you for last comments and surrender the microphone. So this is N9OML. Thank you, everybody, for chatting with me. It was a topic that I thought might be timely and useful. I apologize for the voice. I got up before the net, so I probably have a scratchy voice. Jay, if you could make any closing comments related to the discussion, and then take the net back, N9OML. Over to you, sir.
Thank you for leading the discussion, Howard. In a moment here, Andy, WJAD, does have access now on his OpenSpot 3 using Fusion. I also have a little concerns just perceptually from reading how many individuals are planning on leaving the profession. So if that's a permanent situation with an aging population and less people desiring careers in the health fields, and some of the percentages I heard were like 2 in 5 physicians and 3 in 5 of other ancillary health personnel might be considering leaving. That's going to create a lot of long-term mental health stress for the remaining individuals that are trying to serve their patients, no matter what type of care they have in the future. So the health system might have some implications there. WJAB, go ahead, Andy.
Well, good morning. You everybody have a copy on me at this point?
QSL, good copy, Andy. And I know you have a large family of providers, many relatives that are in the health profession, so hopefully you've been able to hear the stream for the discussion and can offer some input in your perspective, not just in general what your feelings are on long-term stress, mental health stress, short-term and long-term in the medical community from the effects of COVID-19. Go ahead.
Well, that's good. Sorry, I apologize, couldn't get on earlier. My thumb DV died. Okay. I'm in the Washington, D.C. area visiting my oldest son. I'll be here in nearly a week helping with my 4 and 8-year-old grandsons. This house, so there are no healthcare workers, although one is involved with healthcare research. Of course.
Andy, if you're talking again, you dropped after talking about being in Washington, D.C. in a household where there weren't any healthcare workers.
Okay, did I drop out? I may have timed out. But the other healthcare workers are nieces, one of which is a physician anesthetist in the Navy, and she's been on post on duty where she was the only anesthetist for months at a time, and she got COVID and recovered fine. And needless to say, her job has been magnified. She's expected to be available for innovations, etc. As always on call. Her sister is a CRNA and nurse anesthetist who's been busy with it as well, but less so, because she has a little better support, and she's in the Birmingham area. But, yeah, it is an issue. I've got several friends left in the profession that are having some financial issues because they do primarily outpatient care, and that's their way they generated their money, and had let employees go, and in some cases people have closed up. So many issues going on there as well. So I think that's about it for now. I may time it out again. My internet connection is not great, so we'll give it back to you today and Howard. WJ,
Thank you for participating, Andy. No problem on copying that last exchange. Well, our thoughts are with everyone in the healthcare, particularly our members' families, Susie and your families, Andy, and any of our other members that are under all this stress. The question was asked again, and Jack answered it in part of dental training. My training was just as HIV was coming in, so I'm sure there was a lot more focus on some of that stress at that time, but no, not in particular. I agree with Jack. Most of what I see is substance abuse. However, training. On the other side, though, I do see that the Dental Association has kicked in universally, so they've stepped in to cover the situation with a lot of resources and a lot of support. And I was be curious for those of you in the medical profession, have you seen the same from the American Medical Association? So, Chip and Andy. Andy first. Have you seen from the AMA an extra effort to help the stresses AA4FL?
Yeah, I haven't noticed that much of that. There is some stuff being done on the statewide issues in Ohio, particularly for information about the current statistics of COVID, etc. So that part they've done well with. The And then there's the usual politics that we've dealt with in Ohio, which I think everybody's had their own version of that. So I'll get back to you from WJB.
Thank you. And you were a little in and out there, but got most of that. And yeah, it's a tough time. Of course, in medicine, the AMAs have to deal with the care aspects, whereas in dentistry, they're just there to support their members, but we're not dealing with the morbidity and mortality. Now, scientifically, of course, there's a big oral component to determining how COVID was expressing itself as a disease. So there's been a lot of science going on, but in terms of supporting the dentists in the field, that hasn't been as much of an issue. Chip N5RTF, did you have any observations about what you've seen of the AMA or your specialty group over at the A4FL?
Well, my personal observation and belief is that our specialty groups really no longer represent us. They are hand in hand with government entities. The AMA gets most of its money from publication of the ICD-9, for which it's totally beholden to the federal government. APA is so immersed in political correctness that it's dealing primarily with problems that affect 0.1% of the population rather than the really big issues that affect all of us in N5RTF.
Well, thank you. One difference in dentistry, AA4FL, is that we have the prevailing high percentage of individuals that are in general practice, 79% as we talked about last week. So the dynamics of the support from the professional organizations are much different. Some of what Chip is mentioning from cash flowing organizations is obviously true. Here in Florida, on the FDA level, a lot of the money comes from insurance, but in a good way. I mean, they're fulfilling a need that benefits members and generating cash income, which they use to offset some of the professional dues. So I commend dentistry on taking a holistic approach. But again, they're not dealing with the shock and awe of the disease that they have to do on the medical side, and the amount of stress on the end providers must be extreme to the point where I can understand why many people be considering retiring. But changes will occur over time. The long-term implications for the medical field will I'm sure, wane over time. But there's some good that comes out of a challenge, as we all know. So it's sad. It's sad to see the stress that everyone's under, but in the long run, those of us that remain in business and alive, actually, on the patient side, will benefit from changes in the profession and society that come from being challenged in this regard, being stepped up to the plate. There wasn't a void that said we're not going to do anything. There may have been political squabbles that hopefully will heal in time. But let me let it drop one. But when you're dealing with a once-in-a-century event like this, that no one that's alive or very few people had experienced before, it takes some time to adapt and respond. Unfortunately, there's been a lot of mortality here in the States, but there are questions if another pandemic occurs, will we approach it differently? I mean, the same balancing of public health needs and personal liberties has not been settled, so we'll just have to be part of history. That's all we can do. Are there any other comments, Howard, to turn it over to me to finish up here before we call the net to a close? Is there anyone else that would like to make a comment on any subject? If so, go ahead and make your call to AA4FL.
N9OML.
Go ahead, Howard.
First off, thanks for doing this. I'm glad we got to talk about it. And if you'll indulge me, a partly personal, I hope our educators, our leaders, our administrators are making preparations for dealing with things. I don't want to sound like Chicken Little. I don't think we're heading over the falls, but I think some people will have a rocky road ahead. I remember coming out of critical incident stress debriefings where some of us looked at each other after the people left and talked and said, you know, by the time you get done, if you're not an impotent insomniac who refuses to eat and keeps washing their hands, there must be something wrong with me because I keep asking about it. I hope we don't make people, well, let's not use the word nuts, but I hope we don't badger people. By the same token, I think some people may have some problem, and I hope we increase our recognition skills and have resources available to help the people that need it. One thing in my world, we tended to deploy in companies or teams, not companies like the business side, but as an engine, an ambulance, a squad, or in the special ops world as teams. And you had people around you who knew you and could kind of clue you in that you were acting a little off, which might be enough for you to go get help. I hope we can eliminate some of the stigma and get the word out there that if you need help, it's okay.
Thank you, Howard. I got Jack's message to log in KC3SOK. I'm glad he'll be able to participate, even if we can't get him in on the DMR side. Well, I commend everyone. I commend everyone that's been involved in the stress and done their part to support their patients and the public. Out of respect and recognition, I feel that my next online edition of the Ether, I'd like to plan an issue on emergencies in medicine, whether it be on the physician side of the emergency medical services. And if those of you that are monitoring today or listen to the recording later would like to volunteer to participate and offer articles, we'll go ahead and start soliciting those now, so we have a lot of time to get good input from the many talented individuals that we have in our ranks of the Medical Ambulance Radio Council. It's time for not only the recognition, but also the enlightenment for those of us that aren't aware of everything that's being done by the emergency medical services, and the dedication by those that have had to deal with the emergency aspects of emergency medicine. And of course, we don't want to ignore anyone that's been involved in supporting patients, such as Susie as an infectious disease peds doctor. I mean, yeah. Anyway, we're going to call the net to a close. And 7-3 all, and we'll any suggestions for a subject next week? Go ahead and float them now before we close it. Go ahead. Okay, no suggestions. We'll float that on the Google group this week as to what the topic will be, and hopefully the QuadNet array can work out the technical details to get our DMR side going again for next week. And thank you for everybody for participating today. Have a wonderful week, and a week that's hopefully no surprise stressors like economic fallout due to an unexpected or an anticipated war, I should say. I need to have a cup of coffee. Herbal tea doesn't just cut it here in the morning. 7-3 AA4FL, calling the net to a close, and looking forward to talking to See you next week, 7-3.